The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. On this week's episode, we're going to discuss diverticulosis, diverticulitis, what the difference is, some of the preventions, and the treatments. It's not uncommon for an older patient to come in to establish care with me, and when they're going over their chronic medical conditions, they'll say that they have diverticulitis. Most of the time, what they actually mean is they have diverticulosis. And it's not just a matter of semantics. One can lead to the other, but one is a chronic condition that may not cause any problems, whereas the other one needs significant treatment. So I thought today I would break down what the difference is and what causes it in the first place. So let's start with a little bit of anatomy. Your small intestine looks basically like somebody took a bunch of water hose and just kind of threw it randomly into your abdomen. But when it gets over to the right lower side of your abdomen, it makes the transition over to the large intestine. And it starts right over here where the appendix is. And it comes up, that is the ascending colon or the large intestine. It makes a turn up by your liver. That's called the hepatic flexure. Comes across kind of the top part of your abdomen, makes another turn over by your spleen, and then starts coming down what we call the descending colon. Towards the lower end of the descending colon, it becomes the sigmoid colon and then finally becomes the rectum. The sigmoid colon is where you most commonly find diverticulosis, and we'll kind of cover what those are next. Most of your digestion actually occurs in the small intestine. That's where most of the nutrients are pulled out of the food. When we get to the large intestine, we're starting to pull out more and more water. So as everything enters into the large intestine, it's essentially still just this slurry. And as it moves through the large intestine, more and more fluid is being pulled out. And by the time you get down to the sigmoid colon, that's where it's become basically just stool, just feces. And depending on what our diet looks like, it can be very hard. And the body has a hard time kind of pushing it through the rest of the colon. And what can happen is if there's any weakened areas along that intestinal wall, a little outpouching can start to occur. A single one of these outpouchings is called a diverticulum. If you have several of them, it's called diverticulosis. And somewhere north of half of the people that are over 60 years old have it in the Western society. And the reason I say it that way, in other societies that don't eat a lot of processed food, diverticulosis is actually pretty unusual. But with the typical Western diet, somewhere north of half of us over 60 years old will develop diverticulosis. And that diverticulosis does put you at risk of diverticulitis. Diverticulosis usually has no symptoms whatsoever. It's usually just found during a colonoscopy and sometimes on a CT report. Diverticulitis does have symptoms. As far as what diverticulitis is, each one of those diverticulum, with it being an open pocket, there's the potential for material to get into that pocket and hang up, and an infection can start to occur because within the colon there's a lot of bacteria. So if we end up injuring the inside of that diverticulum, an infection starts in and that area gets inflamed and swollen. Usually you have fever that goes along with it, chills, pain in the left lower part of your abdomen, because this almost always occurs within that sigmoid colon that I was talking about. Usually with diverticulitis, we need antibiotics. And depending on the scenario, your clinician may write for one or two different antibiotics. Caught early enough, this can usually be treated as an outpatient with just oral antibiotics, but sometimes it does need hospitalization with IV antibiotics. During diverticulitis, your clinician will probably tell you to be on a liquid diet, and they're not joking. You need to be on a liquid diet. We have to give that bowel an opportunity to heal up, and if we're still trying to move hard material through the colon, it's not going to have that opportunity. Also, your clinician will probably mention to use Tylenol, acetaminophen, instead of the other NSAIDs like ibuprofen, naproxen, some of those. The reason is most of the others can be hard on the GI tract, the colon, and we need to give it the opportunity to heal. So if your clinician didn't specifically bring it up, you may want to ask about what pain medications while you're dealing with diverticulitis. Now then, prevention. If you're listening to that going, well, I don't want diverticulitis, that doesn't sound like fun. And if you're under the age of 60, if you're in your 20s, 30s, 40s and go, I want no part of this when I get older, how do I prevent it? Remember what I said, it's very common with a Western diet, but it's fairly uncommon in societies that have a lot more fiber in their diet. So as a preventative, you want to increase your fluid intake and increase the fiber in your diet, what we call a high residue diet. It makes it easier for the body to be able to move everything through the colon. We're not putting so much pressure on that sigmoid colon, meaning we're less likely to develop diverticulum. And if we don't have diverticulum, we can't have diverticulitis. So if you're wanting to look for a preventative, frankly, eat the way we all know we're supposed to. Now, the one piece of advice I will add to that, don't wake up one morning and decide, I'm going to eat 5 pounds of broccoli and 20 nuts and all these other things. Like most things in life, we need to ease into a diet that has increased fiber in it, or you're going to have some significant bloating, okay? And that's diverticulosis and diverticulitis. Hope you've enjoyed the show. Hope you've learned something. If either one is true, please click the like and subscribe button. If you think there's someone else that needs to see it, hit the share button. Until next time, you better make me look good. See you soon.